tough topic, but a really, really important one. What are some symptoms of late stage Lewy body or Parkinson's that indicate to us as healthcare providers that we might be in a different phase of the disease, approaching the end of life, and really need to think about bringing in our hospice colleagues? No one wants to think about this, and we never want our patients getting to this point, but we may get to a point where we need to think about these things. Someone who is losing their mobility and really is spending the majority of their time in a wheelchair or in bed and is only able to get up with the assistance of another person or a device like a Hoyer lift or a sit to stand, someone who really has lost their mobility, we start to worry that we are getting towards those late stages. One of the things that goes with that is that as people are less mobile and they're sitting or they're lying more of the time, they can develop pressure wounds or pressure sores. These often develop on a person's behind, or they develop on their heels as their heels are laying in bed. This is not a sign of poor care. It's a sign that as people are progressing with a neurologic disease, they may have increasing fragility of their skin and they're losing weight. And that weight is often sort of subcutaneous tissue. It's the cushioning, so that when a person is shifting in bed or they're being transferred, sheets are being moved, just that little bit of friction could be enough to cause some skin irritation and skin breakdown. But when we see especially unintentional weight loss, even though they may still have a belly, their arms and legs are getting really skinny, their face is looking thinner, the clothes are fitting more loosely, that's a sign that we may be approaching the last stage. If someone is starting to have low blood pressure that is not responding to a lot of the medications that we use to try to boost blood pressure and keep a person awake and conscious, that can be another sign. Or if a person is starting to sleep for most of the day in addition to the night, and it's really hard to get them awake, you wake them up, you feed them breakfast, and they kind of nod off. You wake them up again to feed them lunch, and they nod off again, and the same for dinner. Those are all signs that we may be approaching the end of a person's life, and we want to make sure that they are surrounded, not just the person with Parkinson's or Lewy body, but the care partners and the family have as much support as we can possibly bring. And that often takes the shape of bringing in a hospice agency to provide supervision in terms of a nurse who visits about once a week, maybe a social worker, maybe a chaplain, help with some of the supplies that we might need at the end of life, like providing a hospital bed or incontinence supplies, and they can also help provide medications.